Hi everyone, good morning to all. I am Prof.Manavalam working in SNS College of Nursing. Today we are going to see an interesting topic in midwifery and obstetrical nursing, that is amniocentesis. It is one type of invasive procedure they are commonly doing during the prenatal period in order to assess the fetal well-being. Amniocentesis. Synthesis means it is nothing but puncture made over the cavity. In this, they are making a puncture over the amniotic sac. It is one type of clinical procedure and also it is not invasive procedure performed during the time of pregnancy, mainly during the end of the first trimester or starting of the second trimester. It's commonly done between 14 to 16 weeks of pregnancy. Because why they are doing in that period of time means that time only the amniotic fluid volume is 30 to 15 ml. So at least they need 15 ml of amniotic fluid for the diagnostic evaluation. That is the reason they are doing. At the same time, it is one type of early diagnostic method to find out the cytogenetic abnormalities of the fetus. It is very much helpful to terminate the pregnancy if they are finding any abnormalities. In this method, they are obtaining small amount of amniotic fluid from the sac. They are sending this one for cytogenetic analysis. Next, we will see about the amniotic cavity. Amniotic cavity means it is nothing but it is otherwise called as an amniotic sac. It is surrounding the fetus. It's mainly giving the protection to the fetus against the injury as well as the pressure exerted during the time of uterine contraction that felt throughout the pregnancy. It's mainly severely the mother felt during the time of labor. So it has, apart from that, it has the other functions also. The amniotic fluid actually it has the fetal exfoliated cells, transudates fetal urine and secretion from the fetal lung. So by collecting this amniotic fluid, we can diagnose the many problem that is present to the fetus. At the same time, we can also diagnose the uterine infection of the mother by doing the amniocentesis procedure. There are two indications are there for doing the amniocentesis procedure. It may be due for the purpose of therapeutic, or it may be doing for the purpose of diagnostic. Therapeutic in the sense, so in the sense of giving treatment, they are using this procedure. Through this way, they are treating the mother. In that first one is the therapeutic, under the therapeutic indication, first one is amnioreduction. Amnioreduction, it is one type of procedure. Here they are reducing the amount of amniotic fluid. Actually, a term, the amniotic fluid volume is 800 to 1000 ml. For some of the mother, the amniotic fluid may be exceed more than 1000 ml. So in that time, if it is excessive amniotic fluid also, it is giving rise to complication to the mother as well as fetus. So in order to maintain the fetal well-being and the maternal well-being, they will reducing the amount of amniotic fluid through amniocentesis procedure. Second one is amniomedication. It is not a common procedure used to treat the baby, but sometimes they are giving the antibiotics through this amniocentesis procedure in case of any kind of infection, any kind of infection that is affecting to the fetus. So these are all the two therapeutic purpose they are using the amniocentesis procedure. Next, move on to the diagnostic. First and foremost, in order to find out the genetic and chromosomal abnormalities, they are doing this procedure. Next, to find out the amount of amniotic fluid, it is measured by giving amniotic fluid index. So they are giving the scoring of amniotic fluid index. The normal amniotic fluid index is 5 to 25 centimeter. So if it is going clinically, if it is going below 9 or it is going beyond 19 means it is indicated either oligohydramnios or polyhydramnios. Apart from that, it is also helpful to find out the infection that is affecting the fetus. Next, maturity of the fetus. Mainly this amniotic fluid, it is very much helpful to find out the lung maturity of the fetus. So lung maturity is found out by presence of surfactant. So to measuring the surfactant present in the amniotic fluid, we can easily know about the maturity of the fetal heart. Then we can terminate the pregnancy in order to prevent the further complication. And it helps to identify the congenital anemia of the fetus, infection to the uterine cavity, and it is very much helpful to determine the sex of the fetus. So these are all the certain diagnostic indication for doing the amniocentesis procedure. Next, how we will do the amniocentesis procedure? Commonly, they are using the transabdominal approach to do the amniocentesis procedure. In this procedure, they are doing the procedure under the guidance of ultrasound. Without ultrasound guidance, it is not done, because it may be we can puncture the amniotic fluid, as well as we may induce some complication to the fetus, or may make some injury to the fetus. In order to avoid all those things, under the ultrasound guidance only, they are commonly doing this procedure. Before doing this procedure, certain preliminary steps we have to follow. So first, this is one type of invasive procedure. Definitely we have to get consent from the parent. So we have to get consent from the mother. After getting consent, we have to make sure the mother health as well as fetal health by measuring the fetal heart rate and the maternal vital signs. It is very essential. And we have to make the mother to empty the bladder and lie down the mother on the back, and we have to clean the abdominal area, expose the abdominal area only, provide the privacy, and clean the abdominal area with the antiseptic solution. And we have to prepare the needle for doing this procedure, and this procedure done under aseptic technique. If needed, local anesthetic agent which will be inserted into the area of puncturing. Next, we have to use the specialized, under the ultrasound guidance, we have to find out the location of the fetus, amniotic sac, and the placenta. So this location find out is very essential to prevent the injury to any of these organs. Next, after that we have to clean that area and insert the needle under the ultrasound guidance and make a puncture over the amniotic fluid, amniotic cavity, and insert the syringes to withdraw the 15 ml of amniotic fluid for the cytogenetic analysis. So after taking out the needle, after taking out the amniotic fluid, we have to check that area if any leakage is there in that particular area. After that, we have to make a dressing over that area, and we have to watch out the fetal heart rate as well as maternal well-being. It is one type of painless procedure, but the mother may have the little discomfort by this procedure. In this way only, they commonly used to do the amniocentesis procedure. Next, when and what we will do in this amniocentesis procedure. Actually, this procedure done, already I said, between 14 to 16 weeks of pregnancy. After this procedure, there is a chance of miscarriage, but the chances are very less, 0.5 to 1% of chances are there as becoming as an abortion. But after the procedure, certain things we have to do as a follow. We have to monitor the fetal heart rate, and we have to check the site for leakage. If the mother is Rh negative, mother means anti-D immunoglobulin is very much essential. This immunization we have to provide to the mother as a IM injection. Follow that, we have to send back the mother to we can discharge the mother, and we can make the mother to go back to the home. So after going home also, we have to insert the mother. If the mother is having any type of vaginal discharge, maybe blood or fluid, or the mother feeling the pain in the incisional site, means immediately they have to call the physician and get consultation with the physician. If any emergency, means they have to come back to the hospital, then they have to admit, and they have to have a follow-up examination. So I thought that everyone understood about the amniocentesis procedure. Thank you all.